during lectures. And it's a privilege to be here, especially with Dr. Falzone, who was one of my clinical instructors back when I was a student here. I want to take this opportunity to share with you some of the perceptions and values that I have gained and earned as I practice dentistry. It's all about perception, it's all about values, and here we're talking about debating. What is the purpose of debating? The purpose of debating is to try to convince the other side that your perception and your values are somewhat better than theirs, and if you can't achieve that, you want to be able to reach across the aisle and bring them over to your side so that you can somewhat collaborate and achieve the same goals. Because sometimes, and a lot of times, we're not going to be able to agree on the same things. And when you graduate from this fine, fine institution, you're going to see that there are many, many, many scenarios where you need to collaborate. And if you do not collaborate, you will not reach a goal, you will not reach your vision, and you will not succeed. I want to tell you a little bit about the topography, the geography of oral health right now. And we read about it. We read about it in many, many of the classes that we take here at Tufts, BU, and at Harvard. The perception for oral health and the value of oral health, based on what our legislators think, is not quite exactly what we want them to believe. Let's just take mass health, for example. Medicaid, Medicare, dentistry for the poor, for the marginalized, for those who need dentistry the most. In 2002 and 2003, dental benefits was cut. Whenever there is a fiscal cliff, challenge, dentistry gets cut. Why does it get cut? Why are we the first one in line to get cut? The ultimate savings from that set of cuts was less than 1% of the total healthcare budget. Less than 1%. And is that really 1%? No, it isn't. Because costs were shifted. They were shifted to other departments, to the uncompensated healthcare pool. In the most recent financial crisis, in 2010, Mass Health cut dentistry again. That means that we, doctors, we could diagnose, but we could not treat. We could clean teeth twice a year. We could tell the patients, you know what, you're going to lose all your teeth, you've got periodontal disease, you've got cavities, but you know what? We'll clean your teeth and we'll see you in 6 months and see how everything's going. Well, the state was kind enough, because they were forced to, provide dental care to children under the age of 21. Anybody heard of vertical transmission? If the mother, the father, the family has a reservoir of bacteria and pathogens in their mouth, how are the kids going to be healthy? How is this even possible? The Affordable Care Act. Affordable care. They're putting a 2.3% tax on medical devices. Who's going to be sustaining that burden? The manufacturers? We as doctors, we're not trained and we're not responsible to understand how to analyze financial statements, income statements, cash flow. These are not the key words that we were trained to understand. But in reality, those expenses are going to be passed on and they're going to be shifted, cost shifting, to those who are going to have to sustain the burden. The poor, the regular patients, the cash pay patients. Because the insurance companies are not going to have to carry on that burden. They've got this negotiated fee with the providers. The fees are fixed. Let's talk about another stakeholder in this whole oral health scenario and environment that we deal with. The insurance companies, the tertiary payers. Well, you know what? Recently, the Massachusetts Dental Society, we were all working on something called a bill on non-covered services. And that bill is to prevent insurance companies from dictating what dentists can or cannot charge for services that are not even paid for by the insurance companies. They want to tell us what we can charge for services that they're not going to pay for. Last time I checked, I live in a capitalistic society. I live in the United States. Is there anything out there, any organization out there that dictates price fixes? Is that okay? Are we allowed to do that? No. Price fixing isn't right. It's not capitalistic. I'm a capitalist. I have 3 practices. I'm definitely a capitalist. Right? Capitalism is not bad. Capitalism is an instrument. We're doctors. We deal with instruments. Okay? Capitalism can be an instrument. We can learn to utilize this instrument and make it work for the marginalized, make it work for our patients, or we can choose to let capitalism take over and do the wrong things. And we can let that happen. As physicians of the oral, maxillofacial, and masticatory system, it is our obligation, our responsibility, to reach out across the aisle. And how do we do this? We do this through organized dentistry, through the Massachusetts Dental Society. We do this through entrepreneurship. We must think outside the box. And at the same time, we must not hide in our practices. We must reach out to the community. We must be at the table. We must let them know that we are there when they need us to be there. And only then can we align our objectives, can we get buy-in from the political establishment, from the community. Because they need to see us. They need to know that we care and we believe in what we preach. If we can't do that, dentistry, our profession, will continue to deteriorate. Our power, our voice, the voice that protects our patients, will be compromised because other players would want to come and seek in and take that place and that part that our predecessors worked so hard to earn and gain. That's all I have to say. Thank you so very much.
Thank you so much.